Solidarity, Medirest, Steve Bell, 5 minutes.
Thank Dave and the NSN for inviting me. I'm Steve Bell, I'm Branch Secretary of Bucks Health Unison. I'm Steve Bell, Branch Secretary of Bucks Health Unison. I'm not actually on strike. Mick's one of my members who is on strike, and I'm here representing Unison members in Medirest who are on strike in Southampton and Buckinghamshire. And I'd like to bring our solidarity greetings to the NSN and thank all those who've already donated to the Hardship Fund to help take the struggle forward, and hope that it will continue. We will be collecting today and hope that we can raise a few £1,000s today, and we will be distributing leaflets with email addresses on where cheques and etc. can be sent. And I think it's an important discussion because our dispute in some ways mimics what you're going to be discussing later on, because both Medirest and Bucks Healthcare Trust saying there is no alternative. They cannot pay their workers sick pay and NHS terms and conditions because there's no money. Last year, Medirest Compass, a large multinational, made £800 billion in profit. That was £100 million increase over the previous year, and they still say that they can't afford to pay. The other thing that it mimics is in Buckinghamshire, we're not well known for taking action of any kind, to be honest. This is one of the first strikes in Bucks in living memory for those of us who are active in the trade union. And the trade union movement is not as strong as we would like it. So we've had to, as a branch, Bucks Health branch, reach out and link up with local community campaigns, such as Bucks Save Our Services, such as other community campaigning organisations, to try to extend the support that we're getting for the strikers and so on. And we've had a tremendous amount of success, raising in the first 2 days of strike action over £1,500 from local community. So that's why I think it mimics the discussion that you're going to have in the near future. And I have to be brief. The leaflet that we will be distributing will give some more background information on the dispute and so on. But if I just sort of summarise the dispute, in 2006, unions, employers and the government agreed that there should not be a two-tier workforce in the NHS. The contracted out groups should be on the same terms and conditions as the majority of workers working in the NHS. That meant sick pay, etc., etc. So for my Medirest members, currently they don't get any sick pay. Now, working in a hospital, that has meant that some of my members who've had major heart operations have gone back to work within a week because they cannot afford to take time off. And I think that's disgraceful in this day and age, and especially in a health service which is supposed to take care of its employees. They say that it wasn't funded. The government put in £175 million into NHS budgets. Medirest Compass currently pays 75% of the contract's NHS terms and conditions. So somewhere these employers and Medirest have found the money. Yeah, so we're left with 25% of their employees not receiving it. So we're extending the dispute. We're talking to other workers, such as those in Watford. So if there's anyone in here who's from Watford, please go and talk to the domestic supporters and the cleaners, who are the lowest paid members in the NHS. Please go and talk to them and talk about the campaign. We've had 4 years of negotiations since 2006 to try and get sick pay and unsocial pay for our employers, and nothing's happened, and they're fed up, and we've started now to take strike action. And if I talk a bit about the campaign very briefly, we started from a base of about 30% union membership in Medirest in Buckinghamshire. That's not going up from 6 months ago to now, the situation where we've got between 80 and 100% membership in various sections. So in 6 months we've taken a predominantly young and unorganised workforce with no previous trade union experience from not being in a union to taking 2-day strike action. Mick and I are probably two of the most oldest pickets, to be honest. Most of the pickets are under 30. Most of the stewards, the new stewards that we brought in, are under 30. Most of the stewards and activists, Mick and I again aren't representative of the majority of the workforce. Most of the workforce come from minority backgrounds: Polish, Filipino, Mauritian, Asian, Indian, you name it. They come from minority backgrounds, and our new stewards are also from those backgrounds. And they're leading it, and to be honest, it's a privilege to stand up here to represent my members in the Medirest. So I'd like to thank them, in a sense, for giving me inspiration to sort of get up and stand up here and talk today about what's going on and to widen the dispute locally. Because it has brought together sections of the workers. And Bucks Health Branch has always had the attitude, working in health service, that we cannot fight on our own. We cannot fight the cuts on our own. We need support from the wider public and the local communities. And that's what I think the debate this afternoon is crucial. You know, because as a trade unionist in the health service, there are lots of difficulties in taking strike action. The employers say you shouldn't be doing it. Yeah, a lot of members and clinical staff say you shouldn't be doing it. It'll affect the patients. That's why we need to get out into the community and so on. And we've linked up with the community and various sections of the community to widen and develop the support. So I'd like to thank everyone. I have to finish up, and good luck in the discussions, but I'd like to finish on the fact that your fight is our fight. We do need to fight all the cuts, because if we don't win, then our dispute will not be successful as well. So good luck in the discussions, and wish you all well. Best of the conference. If you see the bucket, please donate.